In the past 24 hours, India has witnessed a record one-day rise in COVID-19 deaths, and as cases continue to rise and states impose stricter lockdowns in the country's third wave. India's health ministry reported nearly 4,200 fatalities over the past 24 hours alone, taking the overall death toll to just under 240,000 rather. Hospitals and clinics are struggling to cope with the surge in cases, and although it's the world's biggest vaccine maker, India is struggling to produce and distribute enough doses to stem the wave of COVID-19 infections. Well, joining us now to speak on what Nigeria needs to do to ensure we don't get hit by a third wave like India is Dr. NESOCHI IGBOKWE. Dr. OKEKE, welcome back. It's great to have you on the show again. It is, of course, another conversation about COVID-19, this time it being a little more alarming. We've all seen what's happening in India. They are definitely struggling under the weight of this third wave. Here in Nigeria, we are somewhat within the midst of a second wave. If you look at India, for example, what, in your opinion, has been the cause of such a gruesome third wave over there, and how can Nigeria defend its own shores to make sure it doesn't become the next India?
So thanks for having me as always. But one thing we need to keep in mind is the amount of variants that are spreading worldwide and globally at this point. Okay, so we have to understand viral behavior. Viruses, when they're around in the community for long enough, they tend to mutate, and these changes to the viruses cause what we call these variants. So in India right now, they're dealing with the B1617 strain, and that's likely what's propelling this latest wave that they are having. But with that said, Nigeria needs to understand that there is potential for a lot of these variants to really travel through the country and exposing the nation to these variants is a really huge cause for concern. And when we have all these changes in the virus and we have these variants, another issue is basically a lack of national preparedness. Okay? We have to keep in mind that in the case of what we're seeing with India, there are so many factors, multifactorial things going on that are causing them to not be able to really take hold and grasp of the spike that's going on. So a few things that we need to keep in mind. One thing is lack of resources and a healthcare system that's really just truly overwhelmed at this point. When we talk about just the lack of resources, lessons that we can learn, Nigeria can learn from India, are about how much supply do we have for the medical needs to help actually take care of patients with COVID. Do we have oxygen supplied ready? Do we have ventilators ready and prepared in the event of another potential wave? Our resources are not as robust as India, and yet they're suffering so much during this crisis. We need to be prepared in the event that Nigeria is exposed to this kind of level of crisis. So do we have oxygen? Do we have ventilators? Do we have enough hospital beds? Do we actually have the capacity to take care of very sick patients? So those are a few of the things that we need to really keep in mind in regards to the situation right now in India and how it could potentially become a problem in Nigeria if we don't learn from what's going on there at this point.
Right. Now, so in India, with over 238,000 COVID deaths so far, and we've been hearing about this contagious Indian variant, which you have just mentioned. A few cases have been reported in Nigeria. Now, can you break down this new variant for the benefit of our viewers and how contagious it is?
So the new variant, it's called the B1617 strain. So when we're talking about variants, just keep in mind, viruses will continue to mutate as long as it's in the community. So when a virus mutates, meaning that there are changes to the virus that occurs over time. So when it continues to replicate, there's a potential for it to have these mutations. And that's pretty much inevitable for this COVID-19 strain. So when you have these different kinds of mutations, these different mutations can drive the virus to have various levels of transmissibility, meaning that with different mutations in the virus can be easily spread throughout the community. So the issue at hand is the variant is pretty much being spread throughout India at this point, their variant B1617. But with that said, there are also other variants being spread in the community as well. We have the variant from the UK, the variant from South Africa. So when you have all these factors together, all these variants spreading around various nations, that becomes a huge problem. Okay? So how do we really solve the issue of these very transmissible variants that are going around? The key at this point is getting a hold of the situation with vaccination. We need to get as much of the population vaccinated as possible. The more people that we can get vaccinated, the closer it is possible to even reach herd immunity. If we get to a point whereby so much of the population is vaccinated, the virus really has nowhere else to travel. It really can't mutate the way it's been mutating and hopping from host to host. And once we actually get a hold of the vaccination situation globally, then that's where we can actually kind of come to terms and take a hold of this pandemic situation. Just to put things in perspective, I mean, just months ago, in the beginning of the year, India was pretty much, proclaiming victory, that they had control of the pandemic in their country and things were basically at bay and things were very well taken care of. And then this emerged, this occurred. Okay. It also comes down to kind of sticking to the basic public health measures that we already know about, that we should all be sticking to anyways. Because I think a lot of the times whenever any nation or country kind of lets its guard down, once you let your guard down, we do have this issue of the emerging infections in the community.
I mean, on the theme of vaccinations, we know that here in Nigeria, the federal government plans to inoculate around 70% of the population, of the eligible population, which I guess around 18 years and above. Between the 2021 and the 2022 fiscal years, they're hoping to do that with the help of course, the COVAX agreement, which is willing to cover around 43.1 million doses to reach the eligible populations. What are your thoughts on the pace of that inoculation process, especially here in Nigeria, where recent figures suggest just only 18% of people reported 18% of the people reported who were covered in this study say that they still don't feel comfortable taking a vaccine. So I just want to wrap up my question again. If the federal government says that it has plans to inoculate nearly half of the population by the end of the fiscal year of 2022, how much faith do you have in the pace of that process in a country like Nigeria, where people are still so hesitant to take the vaccine? I'll let you answer that question, Dr. IGBOKWE, after the break. I'm sorry, we've just come to the end of this segment, so I'll ask you to take a pause in your thoughts until we come back from this very short break. Thank you very much. Please do stay with us. Welcome back to the morning show here on Arise News. We're still joined by Dr. OKEKE IGBOKWE, who's here talking to us about COVID-19. Dr. IGBOKWE, before we went on break there, I did ask you about the federal government's plans to vaccinate 70% of the population, the eligible population, which are those people aged 18 and above, between the fiscal year of 2021 and 2022. How much faith do you have in the pace of that inoculation process in a country like Nigeria, where people are still so hesitant, not only to be tested for COVID-19, but hesitant to take the vaccine in the first place?
So thus far, the vaccination rollout has been quite slow, to say the least, in Nigeria. So we need to think about this in terms of the future. If this is actually a realistic goal that they are going to meet, we need to keep in mind two things: the issue of vaccine equity and vaccine hesitancy. First, in regards to vaccine equity, it's it's admirable for them to want to have that patient population have access to the vaccine, but is it actually realistic? With the everyday common Nigerian that is not well off and does not have the means to actually have access to adequate health care, will they be able to really realistically get the vaccination? And if they are making it equitable, the vaccination for that cohort of Nigerians, are they in the category of the population that experience some degree of vaccine hesitancy, which is what we are seeing pretty much globally? There are a good number of people that are quite hesitant for about taking any of the COVID vaccinations. And a lot of this comes down to misinformation about COVID vaccinations. So I think one thing that needs to be done for those that actually are eligible, if they do have access to this vaccine, which hopefully most people should by the end of 2022, if that's the goal, they need to really understand what the vaccination is really about, what COVID vaccines, what it actually means to be vaccinated. Are they getting information elsewhere that may be leading them to be reluctant to take the vaccination? So, for example, a lot of the misinformation that kind of spreads around in regards to vaccinations from my patients that I see here in the States, some of them believe that potentially, okay, the vaccines will harm them, the vaccines will cause issues with infertility for women, which studies are showing that that is not true. Some believe that the vaccines have microchips that are able to track and trace individuals, which is not true as well. As long as we are able to really educate patient populations and let them know about the truths about vaccinations, I think it may be more realistic to actually have those patients that are eligible for vaccinations wanting to move forward with getting vaccinated against COVID-19. But right now, as things stand at this point in time, it's quite an ambitious goal, and I hope Nigeria is able to get there, but we have to deal with those two issues.
Right. So you know, India is home to the world's biggest producer of COVID vaccine, but it is facing a major internal shortage. Well, aside from the vaccine rollout, which we've just talked about, what should Nigeria begin to look out for, perhaps in terms of producing our own vaccines?
So, I mean, in terms of production of vaccinations in Nigeria, I think really at this point, it's really a global effort. There are hopes and negotiations going on in regards to vaccine patent waivers. So potentially there would be an expanded global supply available, and hopefully Nigeria would be part of that as well too. If there's a waiver for some of the intellectual property rights of the vaccinations to be released, maybe that can be a reality for the production of vaccines in-house in the country. But at this point, I think that is a long time coming. So we need to really determine what we can do in real time now in the event of another wave in Nigeria. And with that said, what needs to be done now is really getting back to those basic public health measures that we've all been talking about since the beginning of the pandemic. I think a lot of people worldwide, even in Nigeria, have really let their guard down in regards to this pandemic, especially at this point in time. I know everyone is tired about all the precautions and everything that goes along with these public health measures, but even the rudimentary basics are still so key and crucial at this time. So in regards to mask wearing, is that still happening at this point in Nigeria? If it's not, it still should be an occurrence that's happening to avoid another surge or another wave. Are we still socially distancing? Are we still adhering to good and proper hand hygiene measures and metrics to make sure that we're doing some of the basics to kind of keep ourselves safe? At this point, the reality of it is that prevention is key. we don't do what it takes to prevent the next wave, we might see ourselves as the next India. And that would be a huge problem because we just don't have those resources in Nigeria to deal with such a crisis.
Understood. I mean, in addition to COVID fatigue, which definitely is real, most especially here in Nigeria, and I say most especially because we are all here and we can all see and experience the fact that lots of people are tired of having to deal with this pandemic. But I wonder if another reason could be perhaps Nigeria is doing well. I'm asking because if we look at the numbers from March 2021, for example, Nigeria recorded just under 7,000 new confirmed COVID-19 cases, which was a drop of 72% on the month before, making it the largest monthly fall since the pandemic began. The rate also of cases testing positive did in fact halve to around 3.5% for that month of March. However, the number of tests administered declined by 11.6%. When you put all of these numbers in context, is this good news or is this just another example of perhaps Nigeria not testing enough and that's why we're seeing some quote-unquote positive figures in recent months?
Yeah, I think testing is an issue still. I think there's not a robust amount of testing going on in Nigeria. But I also think just in regards to how we're going to move forward with this pandemic, the numbers, just looking at the sheer numbers that you just spoke about, for some, they might think of it as, oh, we're just doing such a wonderful and great job. But guess what? That was what India was saying earlier on in the year. Mm-hmm. And with the spread and the new variants that are in their population now, we are in this situation at this time. Okay. No one is, I suppose, free from COVID at this point. Okay, let's just put it this way. No one is protected until everyone is protected globally. So we're still at this point in time where there are all these variants spreading in the community that can potentially still affect Nigeria. So maybe the numbers may be seemingly hopeful to some that we're making great strides and great progress. However, the more that these variants are in the community, the more that we're letting our guard down in regards to these public health measures, having all these functions and crowded gatherings and things of that sort, and relaxation of lockdown and specific COVID safety protocol, we are still at risk for what is happening in India being Nigeria's reality. So we really want to try to avoid that at this point.
All right, well, let's talk about infrastructure. Just recently, India began conversion of auto rickshaws into oxygenated ambulances, like a makeshift structure to cater for patients. You know, here in Nigeria, the health system is struggling with infrastructure. Now, what can be done? What can we do to beef up the structure of the health sector in the face of the third wave?
So this all comes down to an underfunded public health system in Nigeria. Also, there's an underfunded public health system in India as well. But this goes back to leadership in the country. We need to address the issue to our leaders. What is going to happen to put more funding and money into public health systems? If we don't have that in play, and if we don't have strong leadership trying to really drive that moving forward, I don't see how we can actually structurally change the public health system in Nigeria and put any of the resources in play that we actually really need. So leadership is really key at this point as well. So our leaders need to basically up the ante and do the needful to really do what's necessary and put in the money and resources into funding that public health system and public health sector in Nigeria.
I guess on the theme of doing the needful, at the first instance, it's definitely about protecting our borders at a time like this. So naturally, we know that Nigeria has already banned, I think the ban came into effect on the 4th of May, which was Tuesday, earlier this week. Nigeria has banned travelers coming from India, Turkey, and Brazil because of the concerns of the spread of the virus in those countries. I know you're a doctor, but speaking to me as like civilian to civilian here, do you think rather that there is any type of positive light coming? Is there any end in sight, or is this something that we're going to have to live with forever? Sometimes it just feels like we come out of one lockdown, we come out of one flight ban into the other. So when do you see this ending, if ever?
I mean, I know we all want to hear that COVID is going to be over tomorrow or tonight or right now. But unfortunately, that is just not the reality at this point. At this point, we just really have to do what is necessary to keep ourselves as safe and as protected as possible. And with that said, the one thing we have at this point, we have our vaccinations and we have the preventive health strategies that we've been discussing over and over throughout the course of the pandemic. I think we can get to a good point realistically when we do have the vaccinations available globally for all nations, and there's really not that vaccine gap between poor and rich nations. I think we can get to a good point as well when we have a good supply chain available to actually afford Nigerians the basic supplies that are needed in order to deal with these kinds of pandemic situations. I feel that we really need to learn from this pandemic, because guess what? It's going to happen again. There's going to be another pandemic of sorts in the future. We might be expecting another wave in Nigeria, but bottom line at this point, protect ourselves with what we have and move forward. Hopefully that things will be better for Nigeria in regards to this pandemic.
Well, as we begin to wrap up this conversation, people have been talking about the different types of vaccine. We have, the AstraZeneca, the Johnson & Johnson. And, here in Nigeria, people have those conversations where they say, oh, I would rather take Astra, I would rather take Johnson & Johnson. Just briefly, tell us what the benefit is of taking any of the vaccines.
So and this is key and crucial, the benefit of any vaccination is that it's going to protect you against severe illness and death if you were to get exposed to the COVID-19 virus upon completion of your vaccination. So the key is getting fully vaccinated. That's first and foremost. But the major benefit is that you are less likely to actually die or be hospitalized from severe illness if you are still exposed to the virus. So we all want to live, we all want to be happy, move forward with our lives. So that's why vaccination is really just so crucial and essential at this point.
OKEKE, IGBOKWE, thank you very much for your time with us.